Welcome to the Reimagine Patient Engagement Podcast. This podcast aims to answer the changing dynamics in patient engagement. What role does technology play in the space, and what are the key initiatives and metrics each individual in the ecosystem expects? Let's get started.
Welcome to Reimagine Health. My name is Donna Rice, the host of this podcast series. Today we are joined by Dr. Sunil Madan, Chief Medical Officer at Luminis Health. Dr. Madan is a leader in population health and healthcare innovation. He has an impressive background, and we are thrilled that he can join us today. Share with our audience a bit more about your background and how you became so passionate about population health and healthcare innovation.
Great. Thank you, Donna, for having me on the podcast. So in healthcare management and in practice for 22 plus years in the Washington, D.C. region. Initially did my training at UC Missouri, Kansas City, and then my residency at Emory University in Atlanta. And then finally ended up with MedStar, a 12 hospital not-for-profit in the region, where I helped manage the ED for a tertiary teaching hospital and a series of other hospitals in the region. Subsequently became the chief medical officer with Luminis Health Doctors Community Medical Center, the newest system in the state of Maryland. Where I got passionate about population health is that in Maryland, we are under what's called a global budget revenue and a waiver for Medicare, how we paid for taking care of patients in the state of Maryland. We are incentivized to take care of patients and population specifically, rather than just those that may be sick who come to your institution. So it became second nature to me based on my day-to-day work in taking care of populations and making their health better. And interested in innovation, specifically when I was at MedStar, started working with Dr. Mark Smith, who's head of Center for Innovation. We developed a product there that was subsequently acquired by Microsoft. There was a data warehouse and had other tools, and got into passion with technology and how technology can help solve the gap in healthcare and help deliver value.
Awesome. So let's talk about innovation. When we think about innovation or the need for innovation, it has to start with a problem, right? A problem to be solved. So can you walk us through some of the steps that you took, how you identified the problem and really decided to kind of innovate to get the solutions and the desired outcomes that you needed to really improve care?
Sure. I think, the problem starts on a global level where we're approaching healthcare is 20%, almost 20% of GDP in the United States. That's unsustainable. 1/5 of your gross domestic product is healthcare. Mm-hmm. Then we look at the outcomes in healthcare. So the cost is one aspect, but you look at outcomes where we rank in the lower third of industrialized countries in terms of outcomes such as mortality and other quality indicators. So we're not delivering value in our healthcare system, and the costs are increasing. So value is really quality over cost, and there are frustrations with silos and many problems within the healthcare system. At the end of the day, when you look at the patient and the ecosystem in healthcare, we're not delivering value, and the costs are getting outrageous. So that's the problem, I would say. Then you look at focus aspects of that problem. So, for example, something simple as readmissions. What's the reason we are having more patients come back to the hospital after they're discharged within 30 days. And you pick any of these problems and you focus in on what are the challenges to the workflows, to the patients, to the providers, and then you start coming with potential solutions or things that you do to help improve those.
Right. Yeah, absolutely. So you had mentioned Maryland as a unique model, and I think we hear of it, but I think a lot of our viewers don't really understand why, Maryland has been kind of ahead of the curve. Can you kind of enlighten our audience a little bit about the unique model in Maryland and some of the innovation that you have done there?
Sure. In the state of Maryland is actually a demonstration project for Medicare by the Center of Innovation. So by CMMI, we've been granted a waiver for how we pay and in the state of Maryland. So hospitals are paid on what's called a global budget, meaning a lump sum of money in to manage within those confines. So, and the quality indicators and other work that's done is based on populations you're assigned as well. So you have to make the health better. For example, If a diabetic shows up with complications of care, such as retinopathy, high glucose, etc., you're incentivized to work with community partners to make sure that they don't have those complications when they land in the ED, for example. And then finally, it's an all-payer model, meaning we don't actually negotiate with payers. Our rates are actually set by the state of Maryland, and every payer has to pay us that rate. Whether you're a Medicaid patient or a commercial insurance patient, we're paid the exact same rate, which is set by the state. So there's no way you're looking at patients, whether you want to treat one patient population a little bit differently because you feel like you get paid better by that payer.
Wow, that's interesting, and I didn't know that myself. So looking at all the issues going around with, health inequities, I think that that's going to really pave the way. You're going to be, ahead of the curve in Maryland. That's quite impressive. So looking at prevention and readmissions, which are kind of the two of the key things that we focus on, right, for providers and health systems and also payers. But on the other side, change is so difficult. Staffing is low. There's not a lot of primary care providers anymore. Things are different, and it's really hard when you're so busy in your day to really stop to say, hey, we've got to bring in innovation. It's just so hard to make that transition to really stop to really implement something else. Any thoughts on that? And how do we really articulate that the message that, if you really want to get meaningful outcomes, you really need innovation is there and you need to embrace that innovation?
Sure. I think the pandemic has been disruptive in many ways. And one of the problems we've reached after the pandemic is that we realized we can't do business like we used to do. For example, labor. Labor costs in certain places have gone up 25 to 50%, dropping or making negative margins for any business. And even if you were able to pay more, you can't recruit or find these individuals. So labor is one thing that's been highlighted after the pandemic.
Absolutely.
So, and when we talk about we have to do things differently, doesn't necessarily mean we need to necessarily get a piece of technology, or we have to think about the problem in a completely different manner. It could be the way we use the technology. It could be the way we deliver care, meaning team-based care. It could be many types of solutions. But we are essentially at a point where the system is breaking, and we have to do things in an innovative way or different. Now, how do you deal with innovation? I think you have to be open to innovation, number one. As an organization, you have to be open to innovation. Number two, you have to do small changes. It's like a recent book that I'm reading, and I'm using it to mentor, coach a leader in healthcare right now, is Atomic Habits. And that is a really great book where it talks about how do you get habitual change. And the way you get change is by small changes. So, for example, there's a famous admiral who gave a speech why it's important to make your bed in the morning. And because the very first action of your day, if you make the bed in the morning, all of a sudden it triggers other actions and then cause change in your day, and you're more productive. But it's the small action of making that bed early in the morning. Similarly, I think innovation takes small changes, takes what we call test of change, meaning you try something, be willing to fail, willing to redirect yourself and your teams, willing to lead. But at the onset, I believe it has to do with being open to change.
I love that concept about small changes. So I've worked in chronic disease kind of my entire career, and there's a very famous behavioralist who talks about small changes and small stops, and you do small stops to really get those big rewards at the end. And I think that's so important, and we need to, I think, apply that to payers and providers and businesses and systems as well. So that's really, really a good point. So looking at that too, how do you get systems or payers to pay money to save money at the end? So it's that initial output. And I think that's what a lot of maybe new startups are struggling with, or, people who really want change, but you've got to make that first change or that first step to reward or to reap some of those rewards at the end. Any secret sauce in that, or messages that you can maybe share with us on how do you do it,
Sure. I think, everyone's struggling at the current business environment for sure. And there's always struggles in business, right? It's a cycle.
Absolutely.
So I think understanding the needs of your customers and coming to your customer with something that you can do some value add. And potentially, maybe it's even for a trial that's free or no cost. But the concept of risk sharing, I think, is becoming very important, where I think payers do it. I think providers are starting to learn and get better at. But it's the idea, for example, if your insurance, you have a healthcare insurance and you have a copay, and that's a form of risk sharing, actually.
Mm-hmm.
The fact that that
is.
service costs $100 and every time you seek it, you're going to pay $20 of it, you're going to think twice about how you use that service.
Right.
So it's a concept of risk sharing, and that's going to risk-based payments or value-based care, and that's really taking off. Whether the models of the Medicare plans, MSSPs, ACOs, all the different formats that Medicare is trying, these are forms of risk or value-based payments where everybody shares a risk, upside and potentially downside.
And that's a good point. And I think as like a health educator, my entire career, one of the things I really felt was missing was the risk sharing with the patient or the accountability on the patient side. And I do think we're seeing that slowly evolve now with more incentives on the patient side as well. So I think that's really good. And I think I'm very hopeful for the future that everybody's going to be accountable for care, and the center of that accountability will be that patient or that person with the chronic disease.
Yeah, I think that's you bringing up a very important point, which is patient engagement. One form of patient engagement may be around risk or financial or some task. Like if you take your sugar on a daily basis, then you get your A1C down, maybe you get a break on your insurance. So, just giving a concrete example. I'll give you an example of my mom who's a diabetic, and it's one of the things I'm passionate about. It's the same as you. I have a lot of family members with diabetes.
Mm-hmm.
Is continuous glucose monitors. For longest time, we've not given it to type 2 diabetics.
Right.
And now it's starting to get available. For a person like me, my mom was 76, but educated teacher, she loves the information and acts on it. So when she's got a continuous glucose monitor because her diabetes is fragile and uncontrolled. And now the data is valuable to her, even as a 76-year-old. She wants to know what it is. She's measuring it 4 times a day, and she's making meaningful change.
Yes.
But if you take the short game on this and say it's an expense, we don't want to give out a continuous glucose monitor, you're missing the long-term gain from it, which the patients engage in their own health and making a meaningful change.
Yeah, absolutely. I found CGM as an excellent educational tool, because when people could see the difference, they see the effects of their meal and their blood sugar. I mean, the light bulb goes on and change happens. But you have to give people the opportunity to be able to process data and to understand their data. Really, really good point. So thinking in terms of kind of like the future and how we're like evolving toward these hybrid models, you have some fee-for-service, some value-based care, some technologies involved. What technologies do you think will be essential to really build connected care models between patients and the care staff? Like what's missing today that you see?
I think, patient engagement tools, anything that engages the patient more in their own care will be important. Mobile health, we're all tied to our phones and live and die by our phones. So I would say mobile health, connected solutions, I think are getting big as well, given that, many parts of the population are using things like iWatches. I also know that companies such as the ones that you work with, for example, the voice-based technologies, are also going to be important. AI, as you see recent news about ChatGPT, and the fact that a ChatGPT bot even passed the medical boards after like answering 60% or something to the questions correctly on a medical board. That's impressive. So AI, connected health, mobile health, more patient engagement tools. These are the things, voice even as a media for patient engagement, meaning the classic, we talk about, interactive tools, but voice or digital voice assistants or voice-based solutions are also going to be important in the way that it's a voice is a different form of engagement than maybe internet or typing a message or etc.
Right. Absolutely. I think it's really important today because so many people just don't want to read or don't have the time to read, or just readability and health literacy is huge today with our populations. Great. So talking about Luminis Health, we know that you're the chief medical officer there. Can you provide like a quick overview and share with the audience kind of your top priorities for 2023 and beyond?
Sure. So, quality and safety always is number one. We're a mission-based healthcare organization where our primary objective is deliver high quality care at low cost of care to our patients. So we want to deliver value to our patients and with the best experience. So patient experience is always at the top. But I believe quality is almost a given in healthcare, meaning it used to be maybe 10 years ago, we talked a lot about quality, we need to do quality, but now it's a given. So you have to deliver more than that. But as a business, I would say, besides quality, which is, I think, a given, is really the challenges we're facing under the margin pressures as the economy and the recession pressures that are there. So number one is negative margins in healthcare organizations, the fact they're losing money, the labor is costing 25 to 50% more. That's a major pressure,
Huge.
given that healthcare organizations are majority labor-based expenses organizations, so that's really important. And I think innovation in the way we do business is going to be important in order to get to the next stage. We won't be able to deliver the care in the post-COVID era in the same way that we did pre-COVID.
Right.
Just not going to happen. You can never find enough nurses. You won't be able to find enough endocrinologists. You won't be able to find enough whatever, name your pick. And we can't deliver care in the same model, in the same manner without innovation.
Absolutely. And I think that's why, when you think about how devastating COVID was, it really opened our eyes to so many of our deficits and the gaps in healthcare. So the beautiful side of it is we're changing now. And hopefully, if there's ever another pandemic, we'll be able to respond differently, and the whole healthcare models will change as well to really, provide better care and better outcomes for people. I think that's so important. This has been great, and I know you're very the time is just about up here, but I just want to thank you so much. I could talk to you all day about this. You've been truly amazing. You're truly an innovator and an inspiration, and we really appreciate your time today to share with us and our audience your insights on Luminis Health and population health and the model in Maryland. So I just want to say a big thank you to you, and thank you so much for joining the call.
Thank you as well. Enjoyed talking to you.
The bigger vision of Reimagine patient engagement is to build a community of healthcare transformers working to improve patient outcomes. Patient engagement requires patients to be in the circle of care to ensure their care is holistic and not as a snapshot during a moment of crisis, but as a view that is ongoing, continuously enriched and deepening over an entire lifetime. So, to be part of this amazing community and contribute to the vision, reach out to us at www.connectedcarecircle.org. That's www.connectedcarecircle.org.